Good to see that. So we're going to talk for the first part of this session about how to ask or pose a good research question. And that may seem sort of obvious at first, but when you think about it, your research question and the way you pose it is really the foundation for your entire research or investigative project. It's the basis for the hypothesis that you'll eventually generate and then with that hypothesis, how you will design your experiment, and you will, at that point, I hope, if not during the hypothesis generating phase, collaborate with a biostatistician because if you don't know how you're going to design your study, what biostatistics you're going to use, you won't really know how to design the study so that you actually get meaningful results. So message one, which I always emphasize, is you don't wait till you've collected your data and have a pile of data and go to a biostatistical colleague and say, help me make sense of this, but really need to start at the very, very beginning. So I want to emphasize that point. And with that point, though, you do have to come, any good biostatistician will ask, well, what questions are we trying to answer? What exactly do you want to know? And so you have to have that solidified in your mind before you can go forward. And we'll talk about some of the elements of what makes a good research question. I love this quote. It's, if you can't explain it to a 6-year-old, you don't really understand it. And that's true about your research question, and we'll come back to the idea of simplicity. But I think, and this was attributed to Richard Feynman, a famous physicist, and it's true, if you find that you can't, say, go to a biostatistical colleague or another colleague and say clearly what your question is, you probably need to do some more work and understand, what am I really trying to ask? What new knowledge am I really trying to create? So that's one of the first and most fundamental points in the whole process. I think asking a good research question is similar to what I was taught by an expert in patents about what makes a good patent. And she taught me the acronym NONE, which the first N stands for novel. So obviously we're talking about new knowledge creation. So we don't want to simply replicate what somebody else has done, even though part of science is confirmation. Really, we want to move the field forward and add to what people have done. So you want to have something that's novel that you're interested in looking at. And we'll come back in a moment to what the criteria the NIH uses to review grants, and that certainly includes that. At least in the biomedical sciences, we generally want something that's useful, that's applicable, that we can apply to the biomedical world. Now, I think there are areas in which there is knowledge for knowledge's sake. There's an intrinsic value, but that generally isn't what is in our area. My favorite illustration of that is one of my colleagues a few years ago said that the basic biochemistry department was having an expert come to talk about, he'd done a lot of work in the crystal structure of hemoglobin. So the medical biochemists went over to listen to him, and it was a very elegant talk. But in the question and answer, one of the medical biochemists asked him, well, how do these crystal structures affect oxygen binding? And he said, I don't have a clue. Why do you care? So that's, the difference between people who maybe are in knowledge for its own intrinsic value. But in our world, generally, we want something that's useful and applicable. The third N is a little bit of a stretch, but it's non-obvious. So if you are going to do something that is obviously, anybody could reason this, deduce this, then it's probably not going to be a useful research question. And we'll come back to that point about how do we really ascertain that something is non-obvious, or can we know that? But that should be a component of your question. I want to call out this reference, which is on the Health Sciences Library web page that is been put together by Fern Cheek, who is a research librarian. And if you search under the library's search page under research support, this page will come up. And each one of these ovals, when you click on them, is associated with really important and useful resources, including beginning your research and asking a research question. And how you set... Oh, good, good. Thank you. Great. Yeah, so it's a good resource. So this is from also one of the resources that I believe is on the research page. So some of the advice of how to develop a good research question. So search by identifying a broader subject of interest that lends itself to investigation. Perhaps you're interested in general in the idea of childhood obesity. So that's your kind of big area of interest that you might step out into. And then next you want to do preliminary research into the general topic to find out what's already been done and what literature exists. How much has been done on childhood obesity and what types of studies? Is there a unique area that you are yet to, has been not investigated clearly? So I think that can help inspire a lot of what your research question is. What's out there? What are people doing? What's in the field? And then what are the gaps in knowledge that might start motivating a research question? And as they show here in this research, there's actually a good YouTube video that's worth looking at, I think, about generating a research question. Then you want to narrow the topic down a little bit by asking more open-ended questions, how and why questions to yourself. You know, maybe you'll ask, well, what are the factors contributing to childhood obesity? Create a list of potential questions for consideration and one that is interesting to you. And I think that's really not a minor point. You know, find something that really inspires your interest and passion, because there's going to be a lot of work to do in a good research project. And if you're not being motivated by something that really fascinates you, is something that is a passion for your interest, then you probably are not going to have the motivation to get it finished. So in addition to all the other factors in creating a good research question, you really want to identify something that, you know, my curiosity really calls to me to do this, and this is something that I'm passionate about and I really want to work on. Finally, evaluate the question by using the following guidelines. Is this research question one that's of interest to the research and potentially others? In other words, is it something novel that will create interest? Is it a new issue or a problem that needs to be solved, or is it attempting to shed light on previous research topics? So you may think of a question that builds on other research. Is it one that's really researchable, and is it possible in the time frame that you have to do your research? Dr. Lehman and I were talking about a fellow in our division several years ago who basically wanted to do a randomized clinical trial that probably would take multiple sites. Well, you know, we had to, you know, let him know that's probably not something you're going to finish during your fellowship. And so what is your availability and what is your capacity to do this? Are you, very important, are you going to get measurable data from your question? You know, are you going to be able to say, how is it that you're going to tell that you've either proved, or I won't use the term proved or disproved, I'll use that loosely for now, but I'm sure Dr. Lehman will talk more about you know, whether we reject or accept hypotheses, but one way or the other, are you going to have a way to answer your question? And is the topic too broad or too narrow? In Fern Cheek's Resources, I think, she has at the very beginning steps to begin your research. And again, this again, supports the things that I've just said. Identifying a topic, search the literature for past and present research. This link is shown here is to comprehensive searching. So you probably want to do a comprehensive literature research. And the link here will show you ways to do that, and research librarians are there to help you do a comprehensive research that may be more than PubMed. You may need to go to resources like Cochrane Reviews or Scopus to really make sure you're covering all of the research. Look for collaborators in this area. This is a little out of date. We aren't using Research in View anymore. Those of you who are getting close to joining the faculty, there's something we're using called Vitae, which is, let's put it this way, I'll just say it's problematic at the present. I'm not even sure if you can search quite the way, but one trick is you can always go to PubMed and put in a topic or number of topics, and PubMed will allow you to identify an institution. So if you put in childhood obesity and The Ohio State University, you'll pull up a list of papers that have at least one author from The Ohio State University. So you can start identifying collaborators here that you might want to talk with. Clinical trials, I put down at the bottom here, clinicaltrials.gov is a very useful research if you're doing a clinical trial, but it may also tell you about other more studies that founded or based the clinical trials so that you're not reinventing the wheel. So is somebody really already working in this area? And it's very discouraging. Just like doing a literature search, you don't want to start a project and find out that another institution is 2 years ahead of you in what you're doing. And I'll also tell you that on study sections with the NIH, almost all the reviewers look up clinicaltrials.gov to see, well, somebody else is already funded to do this study, so why should we fund this? So make sure somebody else isn't already in your area, but if they are, they may also inspire a novel aspect of this research that you might want to develop into your own research question. You can look at the NIH Reporter, AHRQ's website, the Agency for Healthcare Research and Quality, because they show their grants database, so maybe you're more interested in quality research, health systems research. This is a good place to look there. And of course, a variety of research and citation managers, as you're accumulating these data, are useful to you. I'm always curious, how many people use RefWorks here? How many people use EndNote? Okay, and how many people use Mendeley? Okay, yeah, okay. I mean, RefWorks, I use, it's free. That's my only thing about RefWorks. It's, if you're at Ohio State, it's free. I always worry, I used to use EndNote a lot, but I had to keep updating EndNote, and RefWorks, it just automatically pushes the, and I don't get any money from RefWorks, but I'm just saying, that's my favorite, but it's not actually, in many ways, as sophisticated as EndNote. So as I mentioned, as you think of the research question, knowing what the NIH and actually almost any funding agency is going to ask about your proposal, again, fits very well with the what we've said about what makes a good research question. The NIH, one of the major criteria are, is it significant? I mean, is this what you're going to reveal and discover in your research? Is it something that's going to be significant? Is it going to be useful? Is it going to have some outcome that helps us? Is it innovative? So remember, we talked about novel as one of the major things. Are we doing something that is innovative in terms of the technique, the way we're discovering the new knowledge? So, in your question, think about, are you going to be able to approach something in an innovative way? Do you have, you may have a great research question, but maybe you don't have the investigators around here to work with you on that, to collaborate with you. And so you have to kind of think of a question that is also going to be answerable within your environment, and which is the other factor. You know, I had a student in one of our programs who was in ER medicine and wanted to do a project in a certain aspect of head trauma. Well, it turned out they didn't have enough of the kinds of cases that she needed every year to really answer a question. So she had to modify her research question to make it fit with her environment. And your approach, are you going to ask a question that is something that you can actually have the resources and the investigative resources to accomplish at your institution? You know, if you need, you know, if you're going to do massive parallel sequencing, do you have a source that is actually going to be able to do that for you? So there are some practical aspects. I think, you know, you want to think of a question that's inspiring to you and is novel, but also it has to be accomplishable within your environment. And as I alluded to, it has to be testable and measurable. How will you know if you've answered your question? And also, what do you think your answers will be as you formulate the question? What do you think the possible outcomes are? What is to be learned by the question that you're asking? Again, this gets back to the simplicity issue, and this was from Steve Jobs. He stated, simple can be harder than complex. You have to work hard to get your thinking clean to make it simple. But it's worth it in the end, because once you get there, you can move mountains. So again, getting the question down to a simple version and one that, you know, you can clearly explain to others is a major feature. So here's some examples of good and perhaps not so good research questions. One category is you might be too narrow. What is the childhood obesity rate in Phoenix, Arizona? Well, it's narrow because it can be answered with a simple statistic. You can just collect some data and there's a yes or no question, but, you know, if I walk up to you and say, you know, 50% of the children in Phoenix are obese, you could say, wow, that's really interesting, but, you know, what's it mean, you know, and it's not really a good research question. Getting less narrow, you might be, how does the education level of parents impact childhood obesity in Phoenix, Arizona? This becomes a less narrow question. It has enough specificity, and it should provide the opportunity for you to formulate some kind of basis for not only a question, but what you're going to propose in a hypothesis. It may be unfocused and too broad. So what is the effect of childhood obesity in the United States? Well, that's a massive question. How are you ever going to answer that? It's just entirely too broad and not something that is really answerable. But if you do something more focused, like how does childhood obesity correlate with academic performance in elementary school, now you have a very clear focus that can be used to collect appropriate data and build a research question. Hi, come on in. I'll start over. No, other features of a research question, it can be too objective. How much time do young children spend doing physical activity per day? Well, that question, the researcher can collect the data, but again, it doesn't really create any kind of argument or basis for a truly conceptual new knowledge discovery. But more subjective, what is the relationship between physical activity levels and childhood? Now that's more suggestive and now forms a basis for what you can go ahead and when you think about finally writing up your study way down the line, what are you going to tell people that makes this important and interesting? Too simple a question. We do want to be simple, but we can be too simple. How are school systems addressing childhood obesity? Again, that's like asking too broad a question, and also you may be able to do that just with a an online search without doing your own investigation. A more complex question is, what are the effects of intervention programs in the elementary schools and the rate of childhood obesity among 3rd to 6th graders? This is more complex, requires more investigation and evaluation. So there's a balance between being too simple and complex enough to write a really good research question. And these, I'm not saying these are easy things to do, but what you need to strive for. Other features, obviously you want it to be ethical, and we have a great research source here in Ryan Nash, who leads the Center for Bioethics. So if you have questions about is your research actually going to be ethical, he's a great person, or people in his center to discuss this. And again, relevant, despite academic freedom issues, if you are in cardiology and you want to start asking questions about, basic GI physiology, unless you can connect it to cardiology, your division director may say that's really interesting, but I'm not really eager to support that because we study cardiology here. So that's part of the practicality of research. Now, hypotheses will be discussed much more in detail, but just basically as a prelude, the hypothesis then grows from your research question to be a more specific statement, distillation of your research question. Again, testable, will at least answer a component of your question, and sometimes your question will require more than one hypothesis. And I know we'll discuss the difference between null hypotheses and their alternatives and failure to reject, but just to give that as a prelude. Now, we talked about a little bit about what is obvious and non-obvious, and so one thing that has been stated is that there's never been a randomized clinical trial establishing the efficacy of using a parachute when jumping from an airplane. Actually, I did find in one of the journals, I forget which one, I've got it saved someplace, they actually did publish a fanciful article describing a randomized clinical trial of using a parachute jumping out an airplane and the results of doing that. So, but it wasn't a real randomized clinical trial. So that's really asking the question that we talked about. We talked about non-obvious. Are there things that are so obvious that you don't need to do a study? You don't really need a research question. And that's sort of a difficult thing to sort out. I would think that there might be, but the onus is on us to prove that. So this is a real life example. This is down here at the bottom is Dr. James Young. He's a good guy. I'm not trying to criticize him, but he gave a talk at our Heart Failure Society many years ago that said that some therapies are so obviously beneficial that they do not require a clinical trial. So he would say that, there are some things that are just obvious. You don't need to do a study. They're obvious, and it's silly to do a research experiment. What he was talking about was a procedure called the Batista Procedure. Anybody here hear of that procedure? And you'll see there's a reason for that. This was a procedure that Dr. Batista, who is from South America, had developed, and he actually developed it based on some of the findings in lung reduction surgery. The concept being that if you reduce the size of lungs that are emphysematous, you take the stress off the lungs get better. So he felt that if you had a dilated heart and you took part of the heart muscle out and made the heart smaller, that you took the stress off the heart and it got better. And he actually had in South America, he operated like in the jungles and everything where there really were not a lot of other resources. He was getting really, really good results. And people from the Cleveland Clinic went down and visited him, learned his procedure, and brought it back, modified it, improved it at the Cleveland Clinic. Dr. Young was at the Cleveland Clinic, and they were having great success with it. And that's why he had this, so, you know, we don't need to do a trial because we do this, it's obvious people get better, and so no trial is required. I had a fellow who had been in my clinic who was doing a heart failure transplant fellowship at the Cleveland Clinic at the time, and I saw him at one of the meetings. I had, geez, it looks like this procedure is going really well. And he said, yeah, but you know, these people are having sudden cardiac death, and we don't know why. So it turned out that maybe it's not surprising if you take a big chunk of heart muscle out and put a bunch of stitches in it, you create an environment where you can have so-called reentrant mechanisms of arrhythmias in people. So they went back and were putting implantable defibrillators in all their patients, and within 2 years, nobody was doing that procedure anymore. I never saw Dr. Young come back and do a follow-up to his talk about there's some things that are so obvious you don't need to. But so there probably are, but you really have, I guess one question you always have to ask is, are they really that obvious, or do we really need to do a study to understand this? So the onus is on us if we feel that's true. Sometimes you actually have some help guiding you in a research project. Not all research questions come totally from you. So you may see RFAs, requests for applications from the NIH in a certain area. And so this may seed your research question. I needed another pair of parentheses there, or quotations, but so maybe you'll see an RFA, you know, studies of obesity in middle-income children in the United States. And so maybe your interest hasn't been specifically in that area, but maybe you do research in lipid metabolism. So you may then start thinking of questions that your area of expertise may be kind of spun, and spinning is okay, to answer a research question that fits into this broad theme. And lots of successful research comes this way. It may cause a little bit of a diversion from where your central focus is, but it may also lead to a very successful research question and a way to discover something new. We'll come back to practice in a minute. I just want to talk about this study as just an illustration of a real-life experiment that we did in my clinic that was generated from a clinical observation. What we were seeing several years ago is a large number of patients, an increasing number of patients who were going from very poor heart function, measured by an ejection fraction that was very low, to a normal or near normal ejection fraction. And we hadn't really seen that very much in our careers in heart failure at that point. So it caused me to ask the question, you know, what are the clinical factors that lead to improvement or normalization of heart function? And so that was our research question. And we, fortunately, this came at a good time. I had a lot of statistical support because I was finishing my MPH at that time. So I had people like Stan Lemashow and other people to talk with about how to do this study. And so I did get, you know, my biostatistical collaborators in right at the beginning. And in short, just to summarize, we looked at 53 patients that we prospectively identified with reduced ejection fraction, and wanted to look at people to improve at more than 40%, which is close to normal. And we identified a control group that had the same baseline ejection fractions but didn't improve. And then we went through a process of thinking of clinical variables that we thought might be good candidates between the two groups, and did, with Dr. Lemachaux's help, a stepwise logistic regression model that led to us identifying certain variables that we thought would distinguish those who would recover or not. And we finally came up with a model that you can read about in the literature. So again, I think to me, just kind of illustrating how you can start out with a clinical observation and pose a good question, and then design a research project. And, you know, of course, working with Dr. Lemachaux, if any of you know him, you know, immediately you're going to do logistic regression. It's just, you know, his area. But it actually turned out to be a really good approach to do things.